Hi, everyone. Welcome to another COVID-19 webinar. My name is Jenny Wang, and I'm currently a volunteer of Chinese CACHS. So CACHS stands for Chinese American Community Health Service, which is formed in 2011 by a group of community health outreach volunteers in the Washington metropolitan area. So incorporated in 2016, this organization was granted 501c3 charitable organization in 2017. And until currently, it is entirely running by volunteers. So we had a vision to increase health awareness and accessibility of service to build a healthier community. We engage with partners from local communities and government agencies to promote health equity of over 200,000 Chinese Americans living in this area. And we also hold specific attention to those who are undeserved and having linguistic barriers to health care services. Along the years, we have established partnerships with several organizations. Listing here are some of the key partnerships that we have: the Hepatitis B Initiative of Washington, D.C., the ACC Health Center, which is leading by Ms. Kate Liu, who is also with us tonight. And the Asian American Center of Frederick, who is leading by Ms. Elizabeth Chang, and also Asian American Healthcare Centers from the Howard County. We also have a long relationship with the Coordination Council of Chinese American Association. And of course, there's a lot of major partners, collaborators, and sponsors that we're not able to list it here. Thank you for your support. So as a group, we have community health service from all kinds. We have a community health educations. We have our annual health screening health fairs services. We also have services and activities that which I'm going to cover in the next couple of minutes. We also have a specific educations on COVID-19 and flu. So the annual community health fair is the very first thing that this group was built upon starting in 2011 in North Virginia, and we are able to add another locations in Howard County since 2016. And following that, we have another locations in Montgomery County in 2017. The picture I just shows the group pictures of a lot of volunteers who has been working with us in the past times. And of course, we no longer forget these doctors who spend their weekends with us and seeing patients. We also have a community health resource educations that are currently ongoing right now. And the hardest one I have to mention is the Youth Mental Health Workshop Series leading by Lily right now. And this is, we are currently actively recruiting our participants. We're also collaborating with AHI, the Asian American Health Initiative, to set up health education on seniors programs to helping families with seniors. And we also have a youth mental health first aid service that to train our parents of the Montgomery County area. And of course, not to mention about the public education on the information articles in the local Chinese newspaper, online media, and social media platform. We have a huge CHSS Health WeChat group and currently holding over 500 people. And we also have a monthly publications on the local Chinese media. And this is give you an example that in the 2020 that we published over 19 articles regarding COVID-19, and we have a lot of participants. So as a volunteer in this group, me and other volunteers will always think that we have never been able to do enough to our community. So we also have set up our own web pages that we provide real-time information for those who have limited access to the other social medias or platforms. We also have a hotline services that we cover 3 different languages to our Chinese members, and they are Mandarin, Cantonese, English. So take it whatever you want. So, and we also having a function to addressing specific health problems like pandemic. Since pandemic, we provided a lot of service. In 2021, we're able to set up several weekend vaccine clinics in the Fairfax County of Virginia for spending a couple months. And so showing the picture here is another group picture of the lovely faces of our volunteers. And not to mention about, we have This is showing the snapshot of our volunteers working to helping guiding people in the parking lot. And we have a registered nurses that trying to administer vaccines to the participants. We also have medical doctors, and we also have our other partners volunteer to help to set up the event. So in 2021, the whole year, we served over 300 calls, and we responding to over 300 calls and text message using our Chinese local health support hotline. And we also held over 6 health education workshops and seminars. And we helped to educate over 600 participants. And more importantly, we are able to administer over 1,000 doses free COVID vaccination to those in need. So starting 2021, mid-2021, we also have a community health webinar set up addressing the COVID-19 pandemics. So showing on the left here this is historical, apparently, not so historical, but our first flyer showing Dr. Jin, who was giving us a seminar on the Delta variant. So Dr. Jin is also with us tonight. And we also inviting administrative staff from the healthcare system to try to come out online with us to address questions that posted by our participants. And very fundamental thing that we always do is that we always on WeChat and local medias to try to educate the peoples in this area. So moving on right now, tonight, what we're going to have is that we invited these speakers back together and then put them together. We have going to have a panel discussion to address COVID-19 and its challenges. So AAHI, the Asian American Health Initiative of the Health Department of Montgomery County, is our sponsor. So for the next 5 minutes, for the next couple minutes, I'm going to invite Mr. Mohammed Hassan, if you're online. They're going to introduce this program to us. So I'm going to stop sharing. Mr. Hassan.
Sure, thanks, Jenny. Thanks for giving me the opportunity to be here. I'm going to briefly share with you about the Asian American Health Initiative. I am Mohammed.
I'm sorry, I have to interrupt because I forgot to introduce you. Mr. Hassan is currently the program manager of this program. So sorry.
No problem. Thank you. That saves me some space. So Asian American Health Initiative, so what I'm going to do is I'll talk to you briefly about the history of AHI, our mission, core priority areas, and how you can contact us. So AHI, Asian American Health Initiative, is a county program that was formed in 2005 thanks to the collaboration between the county executive, the county council, and community leaders. AHI's first iteration was the Asian American Cancer Program. From that, we expanded to focus on the broader health and social needs of Asian Americans and develop programs to address them. So in short, AHI is part of the Department of Health and Human Services, Office of Community Affairs. In the Office of Community Affairs, we have 2 other sister programs that address the minority issues of the Latino community, as well as the African American community, known as the Latino Health Initiative and the African American Health Program. Together, we form the Minority Health Initiatives and programs known as the MHIPs. AHI's mission is to improve the health and wellness of Asian American communities in Montgomery County by applying equity, community engagement, and data-driven approaches. Our 4 core priority areas are community engagement, community empowerment, capacity building, and change catalysts. In community engagement, what we do is we participate at community events such as health fairs, celebrations, gatherings, and we even host our own, such as the Asian American Pacific Islander Heritage Month event we had last weekend. Our small business outreach connects businesses to communities, but also supports those businesses in times of crises like the ongoing pandemic. Our health education workshops educate community on topics of interest. We also have a resource coordinator who serves to connect members to health and social programs within the county. We also have a patient navigator program, which is intended to help those with limited English proficiency access to the services they need. This is a free interpreter services where you can call and get services over the phone, but they also have free interpreters that can come at your appointments and do the interpretation for you. We also work in community empowerment, in that we know the government can't do it all. The most successful programs we know are those that have an element of community ownership. And to do this, we've developed multiple programs, such as the Health Promoters Program, where we train individuals in the community to become health champions in their community, providing linguistically and culturally competent services. Our PrEP education workshops educate leaders in the community on county programs so that they can serve as a resource for their followers in times of need, such as COVID-19. We also facilitate mental health first aid training that Jenny mentioned, and we also offer workshops that provide subject matter expertise. Our two biggest focus areas are senior wellness and mental health. To address these, we have developed various tools and programs that can be adapted by faith-based and community-based organizations. Our mental health photo novel project is aimed at reducing stigma through education and raising awareness. It aims to normalize the conversation around mental health. We publish these easy-to-read novels in 5 languages and also can provide assistance in translating them into other languages. Our senior wellness initiative has multiple programs. One of them is what Jenny mentioned, is called the Friends Corner, in which we provide various topics of interest for the senior community. In response to COVID-19, AHI launched its first grants program last year in 2021. This grants program funded community-based and faith-based organizations to provide services in COVID-19 outreach and education, vaccination and testing, provide mental health support, social services support, and education on anti-Asian bias and hate crimes. To date, this program has educated over 52,000 individuals on COVID-19, provided over 21,000 vaccines and tests, and provided over 20,000 individuals with mental health and social services support. Our last core area is bringing about change on how Asian Americans are perceived in the community. We do this by advocating for and educating about disaggregated data for Asian Americans. We regularly have these discussions and trainings on Asian American health and social needs. We try to debunk the model minority myth and health disparities among Asian Americans through these efforts. We have an advisory group of community members like yourself and organizational representatives that form the AHI steering committee that advises and assists AHI in fostering relationships in the community, as well as developing programs. So in summary, AHI is a county government program focused on the health and wellness of Asian Americans. We do this by engaging the community and developing partnerships to serve both the long-term and short-term needs of Asian Americans. Our office is open Monday through Friday, and we are available by phone, email, fax, and you can also connect with us through social media, Facebook and Twitter. If you have any questions or comments, please post it in the chat and I will respond to them. And with that, I want to thank CACHS for giving me an opportunity to talk about AHI and our programs. Thank you.
Thank you,
Back
Mr.
to you,
Hassan. Thank you so much. And we invited to stay with the panels. And ladies and gentlemen, it's my honor to invite Mr. Mark Ulrich, the executive of Montgomery County. I'm so sorry. I'm kind of nervous talking to you. So we welcome you to give us a remark. And in the meantime, we also expect you to answer a couple of questions after your remark. And so for our audience, if you have any question, please post on the chat and I will reroute it to Mr. Ulrich after his remark. So ladies and gentlemen, please join me to welcome Mr. Mark Ulrich.
Hi, everybody, and thank you for inviting me to join you today. I guess I want to start by saying, first of all, we have really strong relationships in the Asian community, and they've been built over a number of years, going back to when, County Executive Leggett was in office. And we've continued to try to build on them. You've been great partners, throughout the last 2 very miserable years that we've experienced here. You did a lot of work, starting with folks in your community helping us with the census, And then after the census, just helping on everything medical regarding COVID, whether it was, operating, testing clinics or helping us with vaccinations. We received a lot of donations from Asian companies. Masks in particular were highly valued. They came early in the pandemic when we were having a hard time finding the right kind of masks. We had our employees wearing these horrible cloth masks because they were the only ones we could find. And so you all really helped get us the supplies we needed at a critical point during the pandemic, and we really appreciated it. And I think it made a lot of difference in our response. I think to kind of encapsulate what the county did, we realized probably within a couple of weeks that COVID was person-to-person spread, and didn't linger in the ductwork. It wasn't sitting on the surfaces. It was really hard to get infected unless you breathed it. And so we made a couple of really hard decisions. We went heavy into masking, and we closed a lot of places. We limited human-to-human contact because we knew that limiting human-to-human contact was the only way you would get control of the virus. It needs a host. So when it leaves my mouth, it's looking for another mouth to go into or a nose to go into. If it doesn't find it, it dies. And so we worked really hard to limit transmission, and we were pretty effective at it. And I'd say that, you're not supposed to run human experiments, but there was an experiment going on in the state. We didn't plan it, but as the governor loosened things up, originally we were in sync with the governor. But when he started loosening things up before we thought it was safe, we maintained the controls in the county a lot longer. And what we saw was in the rest of the state where things got looser, case rates and deaths went up. And where we stayed stricter, case rates did not go up at the same rate. So you could actually see what was really happening. And I think it helped for our residents because our residents could see what was happening. They could read the headlines, whether it was about Maryland or whether it was about other states, and they knew we weren't experiencing the same things here. So I think that all of that really, really contributed. The Asian community was the most vaccinated community in the county. People wore masks, and I don't remember ever getting an argument with anybody about wearing a mask. It was very readily adopted. I know when I was looking at international video, you'd see in the Asian community abroad that wearing masks was really kind of normal. I remember seeing early pictures, I think from Hong Kong, of people strolling down the streets and through the markets with masks on, and everybody had it, and everything seemed pretty normal. I felt that I wish we had had the same attitude in the United States that other people had, but we don't, and that's the reality we deal with. But your community was really an exemplary example of what people should do. And your partnership with Montgomery County was really important. One thing we learned out of COVID, and I know one of the previous speakers talked about community groups. When we started doing this, the automatic reaction was that everything would be directed out of HHS. We're the government, we've got an HHS department, we have the resources, and we're going to manage it. And we realized after not very long that we were not as effective as other people could be.
I cannot listen to two.
Hello? So we realized that we could not be as effective as the community groups were. Community groups had deeper ties in the community. They had a level of trust with the community that the government just doesn't have. And there are lots of reasons for it. In the African-American community, it's just a distrust of American medicine because of their experience with some of the things that were done under the name of American medicine that really worked to the detriment of the Black community. For other people who've come to the United States to be away from governments that were more oppressive, the idea of the government being there to help is not a natural instinct. There's a lot of distrust for things that come out of the government, and people trust the people they know. They trust the churches, they trust the community organizations, they trust the people they've worked with and developed relationships with. So we pivoted our response to involve a much greater role for the community groups in the decision making. And spontaneously up in the Germantown area, a hub popped up. The hub started out as distributing food. They were distributing food and clothing, and then they were distributing test kits, and then we had vaccinations, and it became a real model for what we could do. And so out of that one hub, we had multiple hubs spread around the county. And what I've told my people to do is we put the hubs in the budget every year. We're going to retain this model as a permanent model. We are going to work to put some HHS services, or at least providers who can connect with the community out in these satellite hubs to facilitate the community being able to communicate with us and not make everybody go to Rockville in order to get services. So I'd say we learned a lot out of this experience. It made us change things. I've always believed that when things aren't working, you look around for other things that might work. You just don't keep doing the same thing over and over again. And I feel like, you really helped us, get to the place that we needed to be in. So I just wanted to thank everybody for all the work they did and all the work we're going to do. COVID's not over. There's no way that this is going to go away tomorrow. And I was, reading, they're already anticipating BA4 and BA5, and they're talking about increased infectiousness and all the things that we don't want to hear. But the good news is we know what to do. Right now we're using hospital occupancy as the metric that determines our reaction, because these viruses have been much more infectious. But on the other hand, with so many people vaccinated and so many other people haven't gotten sick who refuse to get vaccinated, we have a higher level of protection in the community. So we're not seeing the hospitals get overwhelmed, and we're not seeing the death rates. And so the county's pivoted, as has the state and the federal government, to focusing on hospitalization rates and mortality. And we know what to do. As long as it stays like this, we can manage it. We're continuing to encourage people to wear masks. I would wear a mask even if we don't require it. But we know that if we do wind up seeing our hospital rates go up, and it looks like that trend is going to be lasting, then I have no hesitation to talk about going back to masking again and putting some limits on occupancy, because it'll work. We already know it'll work. And I feel, and I've said this to people before, there's no reason for anybody to die from COVID anymore. There's no reason to get sick. If you do get sick, you're likely to get a mild case. We have treatments now. We didn't have treatments before. We've got the vaccines we have today. And if I was going to correct anything, I would focus on not making the mistake of equating COVID with the flu. Because, we told people you're going to get a vaccine, it'll be just like the flu, you'll take your shot every year, which is great, except the vaccines only last 4 or 5 months. And so I think it built a false expectation in people that all of us have to work on educating people that that's probably eventually what a vaccine will look like. But today, that's not where the vaccines are. And so if we're telling you to get it revaccinated after 4 or 5 months, it's not because they don't work, but it's because the greatest protection they have is from keeping you from going to a hospital and dying. And that, for me, that's good enough. I can deal. I had COVID. I had 14 days of COVID. It was pretty mild, other than being pretty long. That is really preferable to being in the hospital and dying. And if that's the only benefit we get out of this, it's a great thing. But hopefully, soon we'll get a series of vaccines that have a longer life. But I think the biggest lesson maybe is, when you're dealing with viruses that have the ability to mutate like this, you cannot predict the outcome. We should not be so sure of ourselves, because we were. Think about last summer when cases went down and everybody was like wild about opening up. Montgomery County had less than 4 cases a day, and it didn't take 2 weeks before that low point reversed itself and started several climbs into much, much higher numbers. So be vigilant, be aware. We'll keep you educated. We'll keep doing updates so that people know where we are with the virus and what's happening in the community. We want to make sure people feel safe and understand that while we can't cure this and end this, we can control it and that we know how to do that. So I'll stop there. If anybody wants to ask me questions, happy to talk to you.
Thank you. Thank you, Mr. Aurich. So in our audience, if you have any question, please post it on the chat. So I will reroute it to Mr. Aurich. And then we do have one question here for you. So how much did the pandemic impact the county's financial operation? If there's any deficiency in the budget, would it impact our, essential services such as, public education or investments on the public infrastructures?
So for the first 2 years, the first year I sent over a budget on the day that COVID broke loose here. And the council made a decision just to do a same services budget. In other words, the budget that we went over in 2019 became the budget in 2020. So we didn't add anything, but we didn't really lose very much. Federal money helped us provide assistance to business and individuals. So we had, pretty good tranche of federal money. Last year in April, we sent over a budget and the council wanted another same services budget. They set guidelines for operating spending and capital spending. And they basically gave guidelines that were less than inflation. And so we basically produced another same services budget. I came into office wanting to do a lot of things. I never got to do them. I could not fund the stuff I wanted to do, but it was stable. And then of course, last year, the federal government came along and poured a boatload of money into local jurisdictions. Montgomery County, along with counties all across this country and states across the country, received a major infusion of cash. So even though our revenues were down, we got enough federal money that we could maintain same services with the federal money. This year, the economy's really recovered. We have record revenues. My budget has no federal money in the budget. We have a pot of about $50 million that we've set aside to deal with COVID, whether we need more housing assistance or business assistance, or we have to buy more tests. We've got that money set aside and apart from the budget. So this budget is funded completely with tax dollars. And because it's a recovery budget, we've been able to do things. We added $149 million over last year to the school budget. We met their needs for what they wanted for their programming, for their classrooms. We added money for bus rapid transit that we've never been able to do before. This year we're putting $20 million into childcare because we want to continue to expand access to early child care for families. We've got money for social workers to go into schools as soon as the school system's able to hire them. That it's been a very slow process because there just aren't a lot of social workers who are looking to either go back to work or go back to work in a crowded environment. And we didn't raise property taxes. So we were able to do a lot of really good things. My housing budget is the largest housing budget we've ever had. 2.5 times as much money going to produce housing than we've ever been able to do. So I feel pretty good about this. No service has been lost. All the nonprofits got 8% increases from over last year. So everybody's seeing additional money. We're standing up a new program in the area of the African American health program. I will say, they were not able collectively to produce the kind of community response that happened in the Latino community and the Asian community. They lack some of the underlying infrastructure for doing that. And so we're going to help them build the infrastructure because we want all these groups to be more successful. So I guess that's, a medium way of saying that I think, we're healthy and we're going in the right direction now.
Thank you. So I think that we expect all those to come in the near future. So we see that the county has put a lot of funding towards the pandemic relief, including the engaging efforts on helping the minority community members, such as in the cultural or linguistic accommodation services. So can we still expect a similar policy from the county in the near future, addressing other health issues?
No, I don't want to change this. I mean, this worked. And one of the things the pandemic showed us are the underlying health disparities. I mean, some of us knew this, and you could say it over and over again till you're blue in the face, but it never resulted in anybody doing anything about it. COVID made us have to do something about it. And having gotten down that road, I don't feel like there's any walking back. So we've talked with the hospitals. We're trying to put together a meeting with the hospitals, the clinics, and the nonprofit partners we have, like you all, to talk about, what has to change with healthcare in Montgomery County. I know the hospitals were alarmed at the pre-existing conditions that many of the patients came in with. They dealt with too many people who had gotten too far down the road, hadn't gotten help when they needed it originally, or came in with pre-existing conditions that should have been treated, particularly in the African-American community. And so we need to do a better job. And so my goal is to put people together to start talking about, how we coordinate our health efforts better. It's good for the hospitals because the fewer pre-existing conditions or the better shape that people are in general, the less risk they face when they go into a hospital. The worse off you are from underlying conditions when you visit a hospital, the greater risk you have of not coming out of that experience. So we want to make sure that we're able to, fully support people. We've done a lot of talking about mental health in schools, but the truth is mental health is a problem throughout the community. And I know that I was talking with Dr. Lee from CCACC about what they're doing, and they're opening a mental health clinic. When I was growing up as a kid here, they had mental health clinics in the county. And the family could bring a kid or a spouse. You could, if you needed to talk to somebody, you could go in and talk to somebody. And they got closed down about 20 years ago. And I'm talking with people about what it would take to reopen clinics in the county to bring back community-based mental health care. So, because the insurance often doesn't cover it or doesn't cover it adequately. And we've got too many people who have been really seriously impacted by COVID, and it's really affecting the mental health in the community. We need to step up. And so I'm hoping, we've asked Adventist to kind of price out a model for us. I'm going to talk to Dr. Lee. I asked him to price out what he's able to do, and we'll see how much we can put together. Make sure it's got to be culturally appropriate. It's got to serve the diverse communities in Montgomery County. It can't just be one big clinic, in one central location. I don't want a sign over the door saying crisis intervention, because people shouldn't feel that way when they're going for help. They should feel like I'm going for help. Everything isn't a crisis intervention. So the tone that you take to things, I think, really matters in how potential patients receive it. So those are the things I'm thinking about going forward.
Yeah, thank you very much. Also, I want to deliver this message to you that Miss Kate Liu from the CCACC Health Center, and she's currently the director of this health center. So she wanted to thank you for your support to the AAPI community during pandemic. So Kate, do you have anything else to say? We give you a brief 4 minutes.
Thank you so much for thank you so much for the support. And we work really well together with DHHS, and we are very proud that the Chinese or Asian community has access to all the resource, the public health resource during the pandemic. That really helps a lot. I'm gonna ask a question. My observation is that the AAPI community rarely kind of stand up and voice our needs and concern. So it does not mean that we don't have those. And we have a theory that the Asian community have very high threshold for pain that also apply to psychological pain. So we kind of take suffering as the way it is and try to solve the problem ourselves. But as frontline worker, we all know that the need is there, and you just need to have CASH and CCACC community organization like this to voice, to bring up the issue.
So
thank you.
I'm familiar with this. I mean, I've talked with enough of folks in leadership who all express the same view that, you know, this notion that it's a model community and everything is perfectly fine just isn't true. Particularly among, you know, the elderly, you know, there's a real reluctance to say they need help or to reach out to help. Then there are the language barriers, which only complicate things more. So I'm not confused that just because you don't ask doesn't mean you don't need. And so, you know, we will gauge how we go about support by working with you, because you are the voice for the voiceless. You're the ones that know what's happening in the community at a level that I'm not going to know. And so, you know, I feel like it's appropriate for us to rely on people with those kind of connections into the community to help direct us to providing help where help is needed. So you can count on my continued partnership and all this. You know, I will always tell you that I am sympathetic and I want to do the right thing, but I do not walk in your shoes. And for me to prescribe solutions to problems, while I may understand them, I may not understand how they play out in individual lives and in the community. I have to rely on you to make sure we're doing the right thing. Good intentions aren't enough. So guidance from people who understand the space is really helpful, and you understand the space.
Thank you. And I also want to say a word about AAHI really taking a lead and leadership, gather all the Asian communities together, and together we have a bigger voice.
Yes, you do. You know, you're 16% of the county's population.
Yes, we should get 16% of the share.
So we have roughly, you know, roughly equal proportions between, you know, I think African Americans about 18 to 19%, Hispanics about 21%. There's no longer large gaps in these communities, and the white population's in the 40s somewhere. Nobody's a majority anymore. All of us are in this. We were always in this together, but we always didn't act like we were in this together. But I think it's a valuable lesson. I think we know that we're codependent. It's like everybody needed to take care of themselves. You know, had a community refused to mask, they would have been making more people in every other community vulnerable. So we're all dependent on everybody having the same information, following the same science, and you know, basically looking out for each other.
Thank you.
Yeah, thank you, Mr. Outreach. That's also the view and goal of CACHS. We've been helping the Chinese communities in this local area. And then we also try to collaborate as many as possible, the agencies around this area, the government, and the other local agencies, just to get peoples together. So our view is not only to the Chinese community. In the future, we'll cover the Asian community, and we try to bring everybody together. So go ahead.
So I was just going to say, when we get this meeting set up with the hospitals, we're going to make sure you're part of it. So
thank you so much.
We need everyone at the table. You also have amazing resources.
That's true.
Things you all were able to do. That center at CCACC is the most amazing center I've seen in the county.
Mm-hmm. We have done a lot of outreach in the last couple of years, and especially for people, like you mentioned, people with the language barriers, and also a lot of senior peoples, they are not very useful to the current media's resources, the electronics and things like that. So that's part of our job right now, to put them on the table and to put them together and to be on the same line with us. So in the sake of time, Mr. Outreach, we thank you, and then thank you that you accepting the invitation here to give us a remark. And then moving on, we're going to have a panel that we invited several speakers together, and from various disciplines. So again, thank you so much, Mr. Outreach. And I know that you probably have to lock off very soon.
I have to go to another event upstairs. So.
Oh, thank you so much. And I wish you have a good evening. Thank you.
Thank you very much. And have a good evening. And thank you for all your work, all of you.
Thank you.
Bye.
Bye. So moving on, let's go to our next session is the panelist discussion. So I invite all the speakers tonight.
Hello.
Oh, I'm sorry, someone muted me. So I invite all the speakers to turn on your video and to say hi to our audience. So we have we have a Dr. Jin Chong Fei today. We have a Mr. Muhammad Hassan who just gave us an introduction on the AHI, and we also have Dr. Wang Cixin, yeah, who is a professor in psychologist, and also we have oh, I think that Helen, are you there?
Yes, I'm here.
Okay, so my window is getting minimized to everyone. So we also have a Dr. Fu and Dr. Xu Lixin, who are the experts in the vaccine field. And we also have expert from the, I think that is a population studies. If you correct me if I'm wrong, Jennifer. So and we also have Kate Lu with us today again, and we're going to share some information together. So and the plan, the plan for tonight's panel is that it's going to be bilingual, of course, and because the majority of our audience is Chinese. And I'm going to put Mr. Hassan in the first one, that each speaker would allow 5 minutes, maximum 5 minutes to answer a couple questions. I would manage the time. And after that, we'll start answering questions that are being posted on the chat box from our audience. So Mr. Muhammad Hassan, you are the first time here, right?
Yes.
That's right. So I was gonna put you on the first. So we have a couple of questions for you. So just feel free that if you want to share slides or you want to just comment on that. So can you talk about the COVID-19 situation in the Montgomery County at the moment? I mean, the statistics, including the case numbers, hospitalization rates, vaccination rates, and then what are the levels are we facing right now?
Sure. I'm going to do a quick slide share. Hopefully you guys can see my screen. So the current community level status for Montgomery County is medium as of May 28th. And this community level status is determined by a CDC standard, which looks at 3 factors. The number of new cases per 100,000 residents in the past 7 days. Is it under 200 or more than 200? Then it determines new admissions and usage of inpatient beds. So the number of hospital admissions per 100,000 population in the last 7 days, and percent of staffed inpatient beds occupied by COVID-19 patients in the last 7 days. So based on that, we're at medium level status. If we look at the cases, we can see we're getting the past 7-day average is about 384 cases per 100,000 residents in the past 7 days. Today's cases were 518. This is much lower than the peak of about 2138 cases in during the winter surge. If we look at the cases themselves, the places with the highest COVID-19 cases are Ashton, zip code 20861, Dickerson 20842, West Bethesda 20817, Clarksburg 20871, and Cabin John at 20818. The second aspect of the community level status is the usage of hospital beds. And right now we're at 7.5% of the inpatient beds are occupied by COVID-19 patients. This is down from a peak of 49.1 utilization back in January. Third aspect is the number of hospital admissions. So now we're at 8 admissions per 100,000 residents. Again, this is down from 42 at the peak in January. Now, when we compare this to the vaccination rates, we're doing good as a county with 95% of individuals that have received at least the first dose, 87% that are fully vaccinated. We're behind in people getting boosters at 55.3. So if you haven't gotten your booster, please do. It will help you, as Mark mentioned, it'll help you recover faster from COVID-19. When we look at the vaccination and compare that to the cases, we can see that while we still have breakthrough cases for fully vaccinated, the number is always lower than the number of cases on the unvaccinated. The same trend is for hospitalization. You can see it's sort of the curves follow each other, but in most scenarios, unvaccinated are hospitalized more often than vaccinated. The number is still much lower than the winter surge. For COVID-19 resources, I'm going to talk about two: vaccination and testing. For vaccination, you can visit the county website to learn about various sites that are available to get your vaccine shot. They're available all through the county. I can post those links in the chat. Now, the appointments are easily available at Montgomery County sites, but if the local pharmacy is closer to you, you can go there to find which pharmacies or offices are offering the COVID-19 vaccine. You can go to the Maryland government page, and they have a page where you can find vaccination centers close to you. For free, for test kits, free test kits are available throughout the county. AHI offers free test kits for CBOs. So if you're a community organization or work for a community organization, you can get test kits from us for your community members. Individuals, they can get test kits and N95 masks at the Montgomery County Library System. Kits are limited to two kits per person per day, and masks are limited to 4 masks per person per day. You can also order test kits through the that are available through the CDC, through the USPS website. This is phase 2 of it. Now you can get 8 test kits through USPS. These test kits are the rapid test. You can also get the at-home PCR test kits at various county locations. And I will post this link in the chat. It gives you the various locations as well as the timings you can get those. So I hope that answers the question, Jenny.
Thank you very much. That's very clear. So I want you to elaborate a little bit. What does medium level, like low level, medium, high? Does it have any like specific guidelines that are towards these levels?
Yes, so let me do a slide share again. So basically it looks at 3 factors: the number of cases per 100,000 in the last 7 days, the number of hospital admissions, and the number of beds occupied by COVID patients. So when it starts off, like the first check is how many cases there are per 100,000. So they look at the first check to determine community level status is how many cases per 100,000. Threshold is 200. If the cases are above 200, then you look at different ratios for the hospital admissions and the inpatients beds. If the threshold is under 200, then you look at a different ratio. In our case, our 7-day average is 393, so the case threshold is over 200. Then we look at, well, how many hospital admissions are we getting every 7 days? We're at 8 right now, so that's the medium threshold. And we look at hospital beds being occupied. We're at 7.5% capacity, so that's also medium. Now, this standard is set by the CDC. I can post this link in the chat to see if so if anyone's interested in how this community level status is determined, you can check it out at the CDC website.
Thank you very much. Thank you.
You're welcome.
So our next panelist Dr. Jin Chongfei, Jin Yiseng. So I think that from this, moving on, the speakers, you are welcome to use Chinese if that would help you to address the question easier. And then I would strongly recommend it. And then 下面一个问题是给金医生。首先我们想知道目前的疫情的形势怎么样？它疫情是真的反弹了吗？
这疫情的情况，刚刚这个Mohammed 做了很详细的介绍哈，从大数据上面做了很好的介绍。我呢就从我自己身边的一些感受给大家谈一谈，因为我每天都接触新冠病人嘛。然后平时呢也会用我的那个就是视频号，Care的视频号，我只要上班我就会给大家及时的花个1-2分钟时间讲一下那个门诊的情况。根据我长期的动态观察下来，是目前的病人量呢是有明显增加的。大概在2个月前的话，我们可能中心整个一天下来哈，可能有个大概1到4个病例是确诊的，这就差不多了。那最近呢，基本上是属于2位数，一般都是在大概10到15个病例的样子。那我们检测的人数呢，当然也是这个一起增加的嘛。然后门诊的量之前的话大概是100左右一天，现在已经达到了140到160，然后所以过来检测的人也是有增多的。那这里面呢，还有不包括的一部分人，是因为现在大家都很方便在家里做检测了，所以这里其实也有很大的一部分，我觉得，因为我们这些区的这个教育水平都还是蛮高的，所以我觉得大家在家测的这部分人群应该还是蛮大的。然后有些时候他们来门诊的话呢，我们也建议他然后在家测，像比如说哈，有些人就是刚刚发生了一些症状，然后呢过来我们做了一个快速检测的时候呢，检测出来是阴性的然后呢，但是我有些时候就会建议他，我说如果你这个症状还是持续了1-2天，还是不怎么好的，或者有发热的，你可以在家里，比如说第2天、第3天的时候再测一下，在这一部分人里面呢，可能有一少部分也会变成阳性。那另外一部分呢，就是来的时候就有发热的这一部分人呢，我会重点的就是关注一下，就跟他们讨论是不是他要给他送一个核酸的检测，那大部分人都会同意的。然后这一部分人里面呢，回来也会有个别的是阳性的，所以这样加起来的话呢，我觉得目前我们比如说门诊量在150的样子的情况下，可能会有接近20个会是阳性的。
好，谢谢金医生。我想这个问题下面这个问题也是我很想问的，因为我自己一个很好的朋友就有这个symptom，他现在一直还在有这个 brain fog 脑雾的现象。那个是真的新冠已经不重要了吗？就没有那么严重了吗？那 long covid 是怎么回事？为什么有人感染后会变成这种状况？多大概率？因为我这个好朋友已经是超过半年了，一直在这个症状里面。
对，这个 long covid 这个话题就比较大了，但是我着重的跟你讲一下，就是你说的这个脑雾这个事情哈，因为之前比如说在 covid 之前，说实话，我这个比如说住院医或者是这个医学院从来都没教过这个词汇，这也是这疫情以来我们就是出现了这么一个情况，但我觉得就是类似的情况在可能其他疾病上面估计也可能会有。只是说以前没有关注度那么高，至于我现在碰到的，比如说是不是真的有脑雾的病人呢？我的确碰到过几个，他就是有这种 complaint， 就觉得自己好像就是反正做事情也会慢一点，脑子反应慢一点，没那么灵光了。其中最厉害的有一个是，他自己也不知道到底是感染的引起的还是打疫苗引起的，反正他2个事情也都做过，然后呢，就他自己就感觉自己各方面好像总是不是他自己，然后甚至有一次他跟我说，他说如果这个问题解决不了的话，我都不想活了，就是也会有这么比较稍微极端的这种病人。然后呢，我看现在也有一些就是好的大学的医疗机构的话呢，他们特意就成立了这么一个这种 institute， 就相当于就是专门关注这些 long covid 的这种情况的。因为 long covid 这个它查起来的话就很复杂，就是特别是神经系统的检查的话都是很多。然后我看他们有很多的一些量表的一些筛查，然后呢还把各个科的医生就也像我们这样组成一个 panel 一样的，他们可能会之间互相讨论，到时候看看会不会有什么新的发现。但至今的话呢，这个也都还是不是特别清楚。 但是的确是有，只是说这个跟我们这个比例发生有多少高，我们不太清楚。然后哪些人群容易得，我们也不清楚。
好的，谢谢。看来这个问题可能还是需要一段时间的研究，可能才能有一些大概的结果。好，谢谢金医生。然后下面我们请出的是福海清博士。福海清博士呢是疫苗方面的专家。我们大家都知道呢，目前这2种 mRNA 疫苗的效果都不错。现在还需要研发新的疫苗吗？因为我们知道很多那种免疫逃逸现在都出来了。如果是的话，会是怎样的一个疫苗？然后以后每年都需要像刚才我们讲到的，会像流感一样每年都要打吗？
大家好。Jenny 问的这个问题，实际上大家都很关心，那就是一个主要原因，就现在使用的 mRNA 疫苗呢，还是有它的有效期比较短，所以还是有很大的缺陷。那么这个长期的免疫记忆性在这2个疫苗上还没有体现出来。但是是不是别的疫苗就比较好呢？也不见得。因为大家针对的这个疫苗的这个抗原都是同样的一个蛋白抗原。所以呢，在这一方面呢，还需要有这个深入的不断的了解跟不断的提高。现在的疫苗的主要研究呢，那就是说如何提升这个免疫的记忆性。那么为了当然就是说对这个变异本身不断的变化来说呢，我们不可能就是说能够就是一步到位，也不可能就是不停的跟着这个变异的变化来改变这个疫苗本身的这个核酸的系列，因为这个是没有止境的，所以这个政策策略方面需要调节。本身搞一个疫苗研发呢，需要很多时间、精力还有财富，所以现在的研究方向呢，就是采取一个就是广谱性的这个疫苗研发，针对一个广谱性的综合性的靶点，或者是一个永恒的靶点，做一个组合型的这个靶点研发。那么这样的话呢，就是我们可以针对这个病毒本身的这个保留部位，就是不会因变异引起到这个免疫能力的低降，这是一个。另外一个呢，就是说我们要增加我们的疫苗的品种。我们现在的品种的话呢，技术是好，但是呢，它是属于一种应急方面的这个免疫反应，不等于就是它能够产生长期性的免疫反应，所以我们要综合使用不同的疫苗的这个综合使用。有些疫苗它的技术方面呢是能够比较诱导这个强烈的这个综合性抗体的，有一些呢可能在刺激这个体细胞免疫方面会得到比较好的效果。比如说我们现在能够清除这个病毒的话呢，主要靠的是 T 细胞的免疫功能，所以在这一块我们需要增强它对这个 T 细胞免疫功能能够达到这种免疫记忆的这种情况。我们现在在这方面还要做一些工作。那么另外一个就是说，我们现在针对的病毒它的入侵的这个渠道呢，都是从鼻、口咽。那么这个我们这上面这个呼吸道的这个抗体呢，不是这个一定是 IgG 这个抗体，而是别的免疫球蛋白，比如说球蛋白 A 呀，或者是其他的这个不同的 IgG 的不同的亚型这个抗体。所以这块呢，我们可能需要的就是说，这个疫苗是不是应该是不同的给药方式，而不是打针，是不是要喷雾，或者是其他的这个给药方式，那么提高这个部分的这个抗体的产生，是不是会更好？所以一个就是要增加一个对疫苗的研究的这个品种， 另外一个就是要提高我们对这个病毒变异产生更有效的这个疫苗的这个研究能力，跟以不变对万变的这种措施，这就是我要说的。
谢谢海清，谢谢你。我觉得说，如果是有一种以一种来应万变的这种疫苗，其实对我们其实是真的是非常有帮助的。希望说在不久的将来，我们真的能看到这样的疫苗出来。下面呢，我们想请出徐立新博士。因为徐立新博士呢也是疫苗方面的专家呢，他目前呢主要是在 FDA。我想问一下，关于这个疫苗和安全性到底有多大？有多少人出现那个血栓啊、心肌炎这种比较严重的状况？我看过不少的报道了，所以你怎么看？
其实疫苗和其他所有的药物都一样。那么药物能够批准上市，首先要考虑就是安全性。你没有安全，就没法去谈它有没有效果，对吧？所以安全有效，这是绝对的两个金标准。那么这个疫苗从它的研发的过程到现在批，已经经历了叫 EUA 和 Approve。那么 EUA 就是 Emergency Use Authorization， 那么就是在你当前没有任何批准的药以后，那 FDA 呢这个标准也不是说低吧，就相对要松一点，就是说在所有的数据还不太完整的时候，它可以紧急授权使用，在授权使用的过程中边观察边收集证据，那么到最后才能就是 fully approve。那么现在这个2个 mRNA 疫苗，包括这个 Pfizer、BioNTech 和这个 Moderna 都已经批了。那么既然 FDA 已经批准它上市了，那这个安全性还是有保障的。那么在之前的病例呢，就你讲的提到了有出现一些心肌炎和一些血栓形成的这种现象，在临床是观察的，这个比例是相对来讲是很低的。那么心肌炎的出现呢，是在2个 mRNA 的疫苗里面有所观察，就是青少年，对吧？那么这个心肌炎的出现呢，大多数是不是很长期的反应，而且也是可以 treatable。那么另外一个 FDA 一个标准就叫 risk benefit analysis， 就是风险获益来评审。那么获益大于风险，从这个整个的发展过程中，那么这是他批准的另外一个标准。那么你提到这个血栓实际上在 mRNA 病例几乎目前来看是没有见到，就是很少，就是说有的可能也不一定跟疫苗有关系，它可能本来有一些基础病，对吧？那么导致在这个以这个腺病毒为主的，比如说Johnson 的这个第2个疫苗，现在有发现出现这个有血栓，比例很低啊，但是这个出现的就是从 FDA 角度来讲，就是说这种是哪怕是1例，那都是比较严重的。所以你可以看到为什么，就是说我个人的观点啊，就是为什么现在2个 mRNA 疫苗批了 ，J&J 的还没有批。那么 J&J 呢，就是说FDA 包括 CDC 就是加强针已经不提倡打这个以腺炎病毒为主的这种疫苗，而是接种 mRNA 为主的疫苗。那么除非你这个个体对这个 mRNA 疫苗载体或者是像这个 nanoparticle 非常过敏，没办法打这个 mRNA 疫苗，才建议去打 J&J。Again 还是风险获利那个风险和这个获益的比，对吧？你打了以后可能有血栓，但是那个比例很低，所以你从中的获益大于风险，那你还去接种。那么现在就是说，为什么第1个加强针，包括第2个加强针，那么 FDA 都建议你去接种 mRNA 为主的疫苗，好吧？谢谢。
好，谢谢立新。好，下面呢，我们请出我们下一个panelist 王慈欣博士，王慈欣教授，我一直叫你王老师。刚才我们俊长也提到说，现在这个 mental health 呢是一个很大的问题。那么我想知道一下说，在这个我们所谓的后疫情或后新冠时代，新冠呢直接导致了很多人有心理健康的问题。在这个后新冠期间呢，改善这些心理健康，特别对我们青少年，你有一些什么建议吗？
好的，好，谢谢 Jenny 和谢谢大家。这我有2个很快的 slides 分享一下啊。 我觉得首先可能大家在想心理健康问题的时候，可能需要考虑到我们每个人的一些基本需求，就是说作为一个人，除了衣食住行和身体健康之外，其实还是有很多其他的需求的，可能跟你吃饭睡觉是一样的。我们很多时候可能想到了这个 survival， 就是生存的这个基本需求，比如说健康啊、放松啊、衣食穿暖啊，这些我们都会想到。但是有时候我们可能会忽略了其他的这些需求，比如说你要 have fun， 就是在工作很辛苦的时候，现在已经9点了，还在听讲座的时候，也希望您有一些玩的时间，是不是？之后呢，也要觉得有成就感。之后我们很多人在这边，也要觉得有一个社会归属。我觉得我们很多人来参加 CCHS 的讲座，是因为我们觉得这是我们一个亚裔的一个 community，this is our community，we feel like a sense of belonging。那就是有这样的 belong， 就觉得你是在一个团体里面呢，是被这个团体里面是可以信任这个团体的，能够彼此支持的，也是非常重要的。还有呢，就是 power， 就是你成就感，你做的这个事情觉得被认可了，做了一个很重要的事情，而且是你有进步的。还有最后呢，一个是自由，就是你是有这个自由的权利的。就可能大家也在关心国内，就上海刚刚解封，就很多人在说，哎呀，自由真好，可以出门了。所以有这个自由，你虽然在房间里面待着很安全，但是你不能出门，这个自由被剥夺也是很痛苦的事情。就是在尽可能的环境下面想一想，我们怎么样能够满足我们自己的这些5种需求，也包括我们孩子的这5种需求。在新冠期间，可能很多孩子不能出去玩啊，不能办 graduation party 啊，之后他们的很多自由或者是 fun 被拿掉了，所以要可能想一想，怎么在新冠之后怎么更多的补偿这些。还有就是对家长来说，对成人来说，就是 self care。在中国可能我们大家想的不是很多，就是我作为一个个人为集体为家庭牺牲是理所当然的啊。但是呢，但是如果我们这个自己的精神状态不好，身体状态不好，也没有办法帮助别人。你可以看到有时候这个 self care 可能就是很简单的，你可能深呼吸，就你可能想象你在你家人做了很好吃的这个汤，你在闻这个汤的香味，数到5。之后呼吸进去，闻闻这个汤好香，之后再数到5，就 from your mouth breathe out， 之后把这个汤吹凉了，就是做10个深呼吸，有时候也是很有帮助的。就是要记得找一些时间，可能就是5分钟时间，可能未必是很多的时间。还有就是 daily routine， 就是要尽可能保持日常作息吧，就是睡眠时间、起床时间、吃饭时间、工作时间和休息时间。就是当我们休息的不好的话，你每天不能睡不着，或者是由于种种担忧睡不着，只睡3-4个小时，这个一段时间之后，肯定就是这个身体和心理肯定都是会出现问题的。还有最重要的是保证你自己有运动的时间和这个和放松的时间。这个是非常简单的讲几句之后，我觉得就是考虑一下你的不同的需求，还有这个日常作息，有足够的时间来放松和运动和休息。
谢谢王老师。
谢谢。
王慈欣教授本身呢，他也是我们这个几个 workshop 的里面的一个主要的一个主讲人。感谢你为社区做了这么多的事情。下面呢，我们想请出 Dr. Jennifer Bowie。Dr. 我应该叫你黄老师，我一直都叫你黄老师或 Jennifer。他目前呢是Georgetown University 的公共卫生还有流行病学的教授。我想让您从您个人的观点，您看一下新冠最终会被控制吗？还是会像流感那样每年都出来？我听到不同的说法了，而且我们更多担心是以后还会有像这样新冠各种各样的病毒传染病出现吗？多长时间会出现一个？你怎么看？
好的我也是有几个很短的这个 slides 跟大家分享一下。是的所以我是在 Georgetown 的国际健康专业做这个系主任，另外呢也在兰德公司做一些这个政策方面的研究。所以呢我们看的可能稍微宏观一点。那么第一点，我先把它变成这样哈，可以看到吗？是对的哈。所以这个是您
那个 present mode
是 present mode。OK，
要 swap from beginning。
你 switch 一下，现在是 dual。
我怎么 switch 呢？
The left corner, there's a button that you can swap it.
OK，yeah，OK，谢谢。那我从宏观角度来说呢，那第一个可能就是看美国整个的一个情况。刚才您问的那个问题就是说，那新冠到底怎么往哪个方向发展？那我们看到美国现在基本上是在经历第5轮这样的高峰。刚才我觉得好几位panelists 还有领导们都提到了。那现在呢，这个高峰虽然是比1月份就是这个 Omicron 这个高峰要低很多，但我们现在也知道，因为很多人已经有在家里测试啊，所以现在我们基本上已经失去了这种比较准确的计量这个case number 的这个方法，所以我们觉得现在的这个case number 并不是说特别属实。但我们也看到，你看像虽然 case number 上升就是这2周以来上升14%，但 testing 上升了大概42%，所以我觉得那这个还是这多半还是 testing， 主要是指的 PCR 的 testing， 所以肯定是有很多的 undercount。那好在呢，就是说 hospitalization 就是住院率跟病死率还是虽然在上升，但是还是在基本上是在COVID 发生之后最低的这种状况。所以我觉得这种情况呢，主要呢也是因为有一些在美国的这群体免疫的状况，对吧？所以要从跟其他国家来比，我们第一个图我给看了一下，那这个是美国的这个图，从冬天的这个高峰下来，现在有上升。那跟对比的一个呢，日本呢也是在1月份的时候开始有上升，但也可以看到，如果要我们加进韩国跟最近的台湾的状况来说，那就可以看到都是这些国家和地区，如果一旦有一个从一个比较严密的这种lockdown 的状况，然后到开放，都是有这么一个很急剧的，这个是南韩的这个数据，可以看一个极度的高涨，然后下来，然后最近台湾的这个数字也在上升。那我们也看到，从去年Delta 和 Omicron 的时候，那个香港的数据也是非常高涨的。那所以我觉得这个现在我们看到的状况，在美国状况并不是说美国是从并发率角度来说，并不是说最高的，但是呢，这个新冠毕竟还是在不断的蔓延的，所以我觉得说新冠如果我们已经结束了，这是不可能的这件事情。那么我们也在经历着，就说那秋天之后会不会等到，因为它慢慢的还是一个呼吸道感染，那当人群多数的进入室内活动的这种状况，然后包括有一些这个免疫的这个能力就是下降。现在的病死率跟住院率下降的比较多，还是因为有一个一定的免疫，或者是自然免疫，或者是疫苗的免疫。但疫苗的免疫，我们现在说大概持续4个月到6个月，可能这个免疫力就会降低。与此同时呢，又有这些新的 variants 哈。现在我们，我记得上一次上个月讲的时候，还主要是 BA1，那么现在主要已经都是 BA2 和 BA2 的一些 subvariants， 现在都是 BA2 number 12这样的。然后呢，我们现在看到这个南非的状况也比较让人担心，因为南非主要是 BA4、BA5，那么南非呢在 Delta 和 Omicron 的时候已经就是有很高的发病率，那么最近呢又有一个新高峰，那么就是担心这个 BA4 和 BA5 对原来得过Omicron 和 Delta 的人还是有可能有重复感染，会这种发病率比较高。那所以现在呢，考虑的几个事情，一个呢就是什么时候做第4个 boost， 对，现在12岁以上的都可以打第4针了，好像，那么现在这个第4针从以色列的数据来看呢，就说这第4针的 保护程度呢，对感染来说，只有8周的时间，好像对感染比较有保护作用。打完了8周之后，好像就没有太大区别。当然，同时这种 B 细胞跟 T 细胞的这种激发的话，对比较严重的病例还是有保护的。所以呢，现在根据这种状况呢，就是我觉得，总的来说还是我们还在经历第5轮新的高峰在开始上升的状态，所以这个是因为免疫力的减弱，也是因为就是大家的现在的行动跟过去不一样，虽然有这些病例，但大家好像生活和工作基本上都愿意恢复正常。那么在与此同时呢，新的这种有免疫逃逸的这个 variants 还在出现，所以我觉得这个状况虽然不用说现在大家不用说像过去那么着急，但是还是蛮严峻的。那么这个我觉得最终给大家的一个建议呢，那还是现在我们第三年第5个 surge， 那我们现在的 statistic 就是我觉得数据呢也都是 underestimate， 然后所以呢，就像我们过去用的就是夏天的时候能够户外活动，尽量户外活动，能够戴口罩或者保持 distance 还是可以。那么最后呢，最终还是要考虑就是 vaccination， 如果有更好的疫苗，或者疫苗到了4个月、6个月，是不是考虑再打疫苗也还是应该考虑的。那么这个图主要可以看到，很快从3月份到5月份，可以看到这个 BA.12 这个新的亚型增长还是非常快的。这是从2月份到5月份的这么几个月，你可以看到在美国国内这几个亚型已经开始就是风起云涌，基本上是变化是非常快的。那当然我们从流行病的学角度来说，也在不断的看一些新的疾病的预防。我大概提了一下，这边就是这是等于是我自己的 notes， 那就看了一下最近的monkeypox 的问题，还有monkeypox 呢跟新冠的影响非常不一样，大家不用担心 monkeypox 成为一个像新冠这样的严重的公共卫生的问题。为什么呢？因为这个 monkeypox 它不是一个新的疾病，那它是从60、70年代就开始出现的。那它的传播能力也是比新冠要低很多，主要是接触和呼吸道传染。那么而且最终的有一点呢，就是说 monkeypox 它的 vaccination 已经是有的，就是我们原来用的就是 smallpox 天花的那个疫苗是可以对 monkeypox 也是有用的，所以现在有些地方已经在用。那当然之所以得到一些大家的关注呢，还是因为现在有600例，那也正在追踪到底这是怎么来出现的。除此之外呢，最后我就提一下 avian flu， 那这个叫禽流感，那禽流感现在也还在进行之中。那最近呢，主要是像鸟类，包括像这种bow eagle 美国的，还有一些 fox。就是狐狸，都就是找出来有这种 avian flu， 现在基本上还没有到人群里面，只有好像科罗拉多有一个 case。那么大家的从防治的这种角度来说呢，那主要还是防治和这个禽类的一些接触。那这个如果开的话，有可能有人和人的感染，那这都还是比较刚刚开始，还没有到达这种 pandemic 的角度。OK， 那我就现在结束。
谢谢黄教授，谢谢你带来这些 extra information， 真的是很有用。我本来想要问你那个关于 monkeypox 的事情的。下面我们请出 Kate Lu。Kate， 我想问一下你能介绍一下那个 CCACC 现在医疗中心还在打疫苗吗？或者是测核酸吗？有没有能不能介绍一下这方面相关的一些服务，最近的一些新的消息？
好的，我能不能就是稍微就是把我们的网站显现一下，让大家就可以上去拿信息。 Hello， 听得到吗？
听得到。
对 ，OK， 好，谢谢。
没看到你 share slide 啊？
没有看到我，好，我再开一下我的网站。现在看得到哈？
现在看到了。
对那我们是那个美金华人中心在 Gaithersburg Maryland 这边，有一个就是感想，就是刚才郡长讲的，就是亚洲人在盟郡占16%差不多以上，然后非裔是18%。非那个西班牙裔就21%，但是 COVID 期间，我们自己的观察就是亚裔真的那个声音和力量都很少，那所占的这些公共资源，他们不会自动的给我们 share， 就是说，所以都是我们要努力去争取，跟他们说我们有这个需要，所以我觉得就是Cash 哈，每一次大华府社区服务，每一次我们有这个活动都一起联手，希望去 engage 更多的我们的社区的群众，然后就说有资源的话，第一时间很快的就给大家有这个服务，所以我觉得我们就是mutually大家合作的非常好，所以非常感谢每一次的讲座都给我一个平台跟大家讲一讲我们的这个服务。我们现在还是会有新冠疫苗，那具体的是，如果大家进我们的 CCACC 网站 CCACC Health .org 这个网站上面，你就会很容易看得到，我们就是有这个 vaccine clinic。那我们目前是这样子，我们每3个礼拜就是会有所有的也不用所有，没有 J&J， 但有 Moderna 和 Pfizer， 然后 Pfizer 每一个年龄段的疫苗我们都会去取，然后就是所以就是大家可以进 CCACC 网站去sign up 就可以，直接就可以 link 到这个 Maryland 的这个网站，挑一个你合适的时间就可以登记。那为什么现在到处都有这个疫苗注射，然后所有的 CVS 所有就是这些药房很多地方county 很多 site 都有，为什么还是有必要有我们这样的那个vaccination 的地方呢？那其实就是社区里面还是有很多人他就是不会上网，他直接就走到我们诊所的门口问有没有疫苗，所以还是会有那样的社区居民。然后记得再早一点的时候，一刚开始打疫苗就是75岁以上的，那他们也根本没有办法去自己登记。然后我们还有一个比较特别的，就是当给老年人去打疫苗的时候，可能打一个花20分钟的，因为他要慢慢脱衣服，然后所以就说在我们的社区机构里面，我们可以很细心周到的，就是会为他们那个着想。那另外就是我们最近也会就是有一些社区居民就是在家里出不来的各种原因，由于疾病的原因或者是就是没有办法出门的，那我们也有试过上门去给他们打疫苗，所以这些都是尽量为社区有困难的居民就是排忧解难。有时候我们不能上门去打疫苗，我们也尽量跟他们联络我们的合作的机构，然后就尽量可以帮他们解决这个问题。测试我们还是有的，那测试的话就是我们有 PCR 的测试，然后有一种就是比较酷，就是flu 和 COVID 的那个 combine 的一种测试，15分钟就大概知道你到底这个是感冒还是新冠，还是2样都是。所以这个是在诊所可以有。那另外就是那个新冠的rapid test， 就是快速测试，康体会定期给我们送一批这个就是快速测试。所以我们有的话，我们就是出席任何的社区这个outreach， 我们都会带过去分发给大家，也欢迎大家 stop by， 你什么时候需要stop by 一下，或者打个电话看一看我们有没有 available， 非常乐意的跟大家分享这些资源。好，谢谢。
好，谢谢 Kate， 谢谢。我们现在已经完成了我们的所有那个 panelist 的 questions。下面呢，我们有一个1分钟的 break。想请我们所有的那个听众呢，都能给我们填下一个评价表格，因为这个对我们非常非常的重要。将来呢，我们需要从这里面获得更多的信息，来怎么改善我们的服务，来怎么共同的来提高我们的服务。Only 1 minute， 请大家真的是花点时间把这个填一下。So Mohammed, we're going to have a 2 minutes break. So we allow the audience to fill in the information, the evaluation form. And after that, we're going to move on to the Q&A session. I believe that we covered a lot of information already by all the panelists. So I would not expect a lot of questions would be asked. So I would like to extend our time maybe to the next 10 minutes or so to address a few more questions. And then we're going to end today's webinar. Thank you. Just to let you know that I don't think the co-owner is able to fill in the form. It's only the participant. All right, so I think that we're ready for a few more questions. So for the next round, we're not going to, I'm not going to invite each of you to come out and answer the question, but I'm gonna throw the question to you. So whoever have any kind of point of view, feel free to jump in. So the first question, and also like the rest of the panelists, you're also welcome to speak Chinese when you're addressing the question. And Mohammed, that I'm going to repeat the question in English for you as well. So I think that we have a question about the second booster. So now that we know that the people's 50 years of age are going to take it. And then we are interested, we want to know that if you don't have any underlying diseases, is it the second booster still needed? Let me repeat the same questions in Chinese. 就是我们现在很多人要开始打第2针的加强针了，如果没有基础疾病，而且又不是特别的老，不应该说不是特别的老，就没有到50岁以上，是不是我们就真的不需要第2针的加强针了？ Mohammed, you want to go first?
So the question about if they don't have pre-existing conditions, should they get the booster? I think there's someone who's a medical doctor. They're better to be able to qualify to answer, but I think yes, you should get the booster even if you don't have pre-existing condition and you're over 55, just because COVID is so devastating on the lungs. It's better not to take that risk, and shots are easily available, so there's no long waiting time. Some places even offer a walk-in shot.
金医生，
我觉得总体上是推荐的哈，第4针，但是呢，有些比如说你如果个人有些特殊情况的，比方说哈，有些人觉得自己是非常非常 low risk， 天天待在家里的，就是也不怎么出去的，然后又没有什么基础疾病的，然后这些我觉得你自己可以考虑哈。但是如果是对一些有基础疾病的糖尿病啊，有一些其他的心脏病啊，肺不太好的啊，对这些人群的话呢，我觉得任何的对自己的一点保护的话，都可能会成为你最后的救命的一个东西。就是这群人的话，我觉得必须要打起来。然后至于有些在中间的，比如说有些人打了前面几针，他这个 experience 是很差的，比如说打了之后这个比如说这个一些有发热啊，然后症状也就像是得过流感一样的，就是这些人群的话呢，那你就要 balance 你的 risk 和 benefit 了。如果是就是 risk 小一点 benefit 多一点，那你就去打。然后你如果自己不确定拿不定这个主意呢，就可以和自己的家庭医生去商量一下这个问题，做一下决定。
好，谢谢。我们有个问题想问一下，有没有哪种 test 可以告诉我们是感染了哪个 variant？ 季医生 Kate， 我想你们在日常门诊的有没有这方面的一些检测？
这个检测都是要送到 CDC 去的，我们门诊不做这个检测的，但只能是通过目前的大数据，比如说现在总体上都是奥密克戎人，那基本上有些时候病人问我们，哎呀，医生你知不知道我感染的是什么病毒株啊？我说那基本上就是奥密克戎这样子。如果他还再继续问是哪种亚型啊什么的，那就 50-50 了。现在是就是一半是 BA2， 还有一个是这个新的亚型了 BA2 12.1这个亚型了。
K 有没有补充？
对大概是没有特别的 test， 然后知道不知道也可能没有特别大的意义，因为那个感染这个病每个人的那个 response 都是不太一样的。
好，谢谢。我们知道说现在5到11岁的小孩的加强针出来了哈，那我想先金医生你先来吧。你觉得这个真的是很有必要去打吗？然后那个加强孩子安全吗？
我觉得2个方面来讲哈，第一个是好像我看到的数据是，就其实小孩子现在接种率蛮低的，就是前面打第1针、第2针的人其实都不是特别多，所以说这也导致了为什么现在我们其实门诊经常碰到的这些感染，要么是小朋友自己感染，要么就是这些家长就是通过小朋友被感染。然后大家也可以看到，家里有小孩的话，现在也都是有这个 email 的提醒，就是哎，今天学校里诊断了多少例，然后有些时候6例，有些8例，每个地区不一样。所以说的话，我觉得如果你家里面只是大人，身体很健康的，只有小朋友的，那我觉得随便你，反正你回来感染了自己身体也好了，也能扛得过去的。但是如果是家里比如说有老年人在一起的，或者是有些人身体不是很好的，有基础疾病的，那我觉得如果这种的话，如果小孩子从这个小学校里把这个病毒带回家去，但是造成的这个后果是会比较严重的。这种情况下呢，我觉得你还是要抓紧时间把小朋友打起来，这样子。
那个Jenny，我补充一点。
好的，好的。
其实5到11岁的孩子跟金医生讲的我都同意啊。其实他们在学校里，他们这个群居的机会比较多嘛，所以他接触外面的机会比较多。所以如果没有什么特殊情况，还是建议去打吧。那么我这里面再补充一点，就关于这个疫苗的安全性，就是前段时间好多人都在问说这个 Pfizer 什么把数据隐瞒啊，实际上是不存在这个问题。美国这个还是那个 transparency 是很好的。所有的这个数据都是公开透明的，如果你想知道，那么就应该有渠道可以知道。只是 FDA 它审了以后不一定马上就公布出来，但是你想知道是可以得得到的。就是说，因为严格讲 FDA 是为 public health 服务的，他也不敢去这个数据造假，因为公司他也不敢去隐瞒，一旦被我们发现了，那这公司就彻底的完了，对吧？所以说这一点就是关于这个数据的问题，关于这个安全性的问题，就我刚才已经提到了。那么 FDA 有那么多 scientists 在的工作，基本上有3个团队在同时的去观察，一个就是产品的质量的问题，第2个就是非临床，还有一个第3是临床。那么多科学家在里面，包括医生，包括这个免疫学家，包括流行病学家，包括这个数据的分析，包括那个统计学家，他一起工作的，就是从他那个 EUA 到他approve， 一般的我们最快的也要6个月，那么传统的就是 BLA 就 Biological License Application 需要10个月去，因为 data 太多。但现在为什么这个疫苗严格讲审的比较快呢？那就是大家是甚至讲有的人是不分昼夜的去工作的，对吧？就是为了更好的为这个公众服务，好吧？谢谢。
好，谢谢立新的补充，谢谢你。我想说这里还有一个问题，就是我也想请那个黄志环教授也刚才我们想知道一下，说以后是不是还会出现这样那样的传染病，这个周期会是多长？我想每个人都会有这样的担忧，因为我们经过 SARS， 现在遇到新冠，然后不知道下一个是什么了，您怎么看呢？
这个新的我们叫 emerging infectious diseases，这个出现是很正常的。我们其实在COVID 发生之前，大概在2018年左右，我们有过很多这种讨论。因为当时就是考虑到1918年那个流感，当时有一个话就是说，那小的 pandemic 每20年一次，那么大的 pandemic 每100年一次。当然这当时就是我记得2018年的时候出了很多文章，就是讨论这个100年纪念日，就是这个1918的这个流感。所以这次看虽然不是流感病毒，是一种新的病毒，但是它产生的效果，对世界的影响，那看来是很类似的。所以当然这只是一种非常就是不是那么 scientific， 但是是一种我们能够 observe 的这种 pattern。其实这个免疫其实是每3-5年都有一个新的，是吧？从 SARS 之后，我们又有禽流感，有猪流感，有那个 Ebola， 有 Zika， 所以基本上其实是作为流行病来说，这个基本上是层出不绝的。那么现在我觉得有一个比较好的现象，就是说自从 COVID， 现在很多在反思这个整个全球健康这个系统怎么来运作。那有这些反思，可能会把这个防御和监测系统做得更好一些。那这个地方就不光是公共卫生，还包括外交，还包括很多国际政策，包括世界卫生组织的位置和这些都在讨论之中。那么有一种说法就是说，以后要看这种流行病，可能就像天气预报一样，就是有这种预报性。那这个现在根据现在的数据系统也在建立，所以我觉得今后对这个病是会层出不穷的，但是可能这个防疫效果经过新冠之后会有所增强。
这也是一部分方面还是有点令人担忧的，因为我最近有很多我收到这样的问题，就是问到说小孩这种这个很奇妙莫名其妙这个肝炎的问题，是不是会又造成另外一波新的流行？
对，小孩肝炎的这个事情，现在也是在多种出现，现在是不是跟新冠有关系还没有定论。那也是因为我们因为有新冠之后，各种人群的行为和生活环境都有很大的变化，所以这个也是跟他这个肝炎有关，所以还是在研究之中。那我觉得至少大家现在对流行病这个状况都比较敏感，也当然有些害怕。那么其中一点，我觉得很多病，包括像我们刚才说的 monkeypox， 还有 avian flu， 大概95%到99%的流行病，基本上都是动物和人之间就是互传的这种病，叫 zoonotic diseases。那么所以呢，现在就提出一个大健康，就是全球就是这个环境的健康，动物的健康跟人的健康是紧密相关的。所以这也是一个不是一个新的理念，但是是一个最近比较更侧重的。但问题就是说，什么东西研究都是需要资金。那一般我们看到很快很多事情都是在流行的时候资金会进来，那很快就是大家结束之后或者慢下来之后就不再继续研究。那所以这个也是一个长期的问题。
对，我想说，作为公众，我们就像刚才傅海清博士提到的一个一劳永逸的疫苗，我们真的是很希望看到一个这样的系统来建立，或者是有这样的疫苗可以让我们真的是能对付，至少是这个系列所有的变种，我觉得这个就已经很能让人满足了。好的，由于时间关系呢，我们不能回答很多问题了。按照我们的一个惯例呢，我们还是请出我们的所有的 panelists， 每人呢用30秒到1分钟的时间做一个小的总结。So, Muhammad, as a routine, we invite all the panelists to give a 30 second to 1 minute as a closing remark. So anything you want to share, anything you want to say to our community. So you want to go first?
I just want to thank you and everyone for giving me the opportunity to talk about the Asian American Health Initiative. as well as offer the resources. It's my first time here, but it was great talking to you guys and seeing a few people in person that I've emailed but never actually met. But thank you for the opportunity, and you guys are doing great work with the COVID-19 outreach efforts, as well as the vaccine efforts you mentioned initially. So it was great learning about CACHS at the same time. Thank you.
Thank you, Muhammad. So after this one, we're going to move into a momentary mode of our webinar. So we're not going to have it like every month like as we used to be, but we definitely keep in touch, and then let's work together for the community. Okay, next one, 金医生。
谢谢大家，也和大家一起度过了这么长的一段时间，很开心，然后能够也通过这个平台把我在前线哈的一些信息及时的反映给大家，我也很感谢大家能够和大家一起坐下来聊这个事情。然后最后呢，我就是想说，反正疫情呢，目前谁也不知道什么时候结束哈，我们能做的就是利用好现在目前可以得到的一些工具，包括疫苗、口罩这些，还有洗手这些事情，来最大程度的做好防护，保护好自己，也就等同于保护好家人。谢谢大家。
谢谢你，金医生。好，下面我们请出海清博士。
谢谢大家给我这么一个机会。我非常就是说热衷为咱们社区服务，但是实际上也做得不够。可以说我们这个社区还是很活跃，特别是我们这边有 FDA 有 NIH 有各种学校，都是我们世界顶尖的这种科学研发中心跟这个财宝，是人类的财富。我在 NIH 已经就是说原来在 NIH 工作16年多吧，实际上这个16年多里面，我们的始终的理念就是开发广谱的新药跟疫苗，为了这个为了明天的这个 Disease X， 因为5年前根本想不到我们会遇到 COVID-19。但是那个时候我们的策略就一直就是要研发广谱，所以今天所有的这个很多的抗病药，比如说那个天花病的抗病毒药，也是我们经过了10年以上的时间去研发。2018年的时候，作为一个在没有人体效果的证据的前提之下，靠的就是这个动物体上的效果来把这个药给它开发出来了。那么今天这些药还有疫苗，对我们抗刚刚王教授说的这个 monkeypox 都是非常有效的。所以要支持整个社区，要支持我们整个国家的这个科学这个技术研发，这方面一定要有不断的努力。谢谢。
好，立新。
很高兴和大家一起讨论一些社区关心的健康方面的问题啊。其实刚才我们那个郡长其实讲得很好的，讲得挺详细的。不是我 surprise， 作为一个我不知道他专业是什么，但是他总结的其实很好。就是从我们角度来讲呢，就是说我希望大家呢更多的去相信科学，去伪成真，利用自己的知识和经验获得一些有用的信息，这样呢学会保护自己，保护你的家人，这样同时也保护了我们社区。谢谢。
谢谢立新。好，我们下面时间交给王慈欣教授，王老师。
好，谢谢CACHS 和大家一起来听这个讲座，也很高兴和各位专家一起分享。之后我想其实还是一个 reminder， 之后请您记得就是我们作为个人是有这5个基本需要的，包括除了健康以外，之后sense of belonging, build a community, and feel a sense of accomplishment, and having fun and having freedom to make choices， 这些都是很重要的。有时间的时候呢，即便您没有时间，也要记得每天做一点点的 self care。你可以简单的就是 stretch， 是不是？之后简单的深呼吸，之后跟家人一起聊聊天，之后祝您和全家身体健康。好，谢谢。
谢谢王老师。下面黄志环教授，黄老师。
你好，所以我觉得第一呢是很荣幸能跟各个专家，特别是我觉得我们的社区特别有资源，然后有这么多人愿意为社区服务，像我们都能够用这个板上的时间，也能够和大家一起共同努力，我觉得这种感觉特别好。那从流行病学角度来说呢，我觉得从新冠上面我们学到很多东西。过去我们一直觉得好像这个公共卫生传染病已经比较遥远。但是我们在慢性病的基础上，我们特别是看到，那即使是有传染病，那有慢性病的基础的话，那这传染病就更厉害。所以呢，那我们可以看到，就是这个健康，不管是传染病还是慢性病，都要有很大的这个投入。希望大家能够，我们在这个社区的环境下，能够互相帮助，互相鼓励。谢谢。
谢谢你 ，Kate。
谢谢再次感谢每一次都有这个机会这个平台来跟大家就是沟通一下我们的服务，也很学到很多，然后今天的阵容堪称豪华，也是非常非常的很就是属于这个社会上王医生讲的有个 sense of belonging， 然后我觉得我们新冠的期间，新冠不是一个好事，但是把我们所有的kindness 和大家关心这个社区的这些好的这些风气都带出来，所以这是我这2年疫情里面的一个感受。我觉得我们中国人社区或亚裔社区其实有很多很多的潜能可以发挥更大的影响力。谢谢。
谢谢 Kate。像我刚才也提到了，说我们本期呢是我们这个每个月的讲座的最后一期接下来我们的这个讲座呢将变成不定期的举办，同时呢我们还要引进其他的那个 health issue。Of course, the pandemic is gonna, I don't know how long pandemic is going to last, but I don't think COVID will be the only thing of our life. 所以说我们将会关注更多的疾病，然后呢像在座的 panelists 呢，以后也是会我们会经常邀请大家来跟我们一起分享一些新的动态。所以呢，请大家真的是在这个时间，真的是像各位专家提到的那样子，保护好自己，保护好你的家人，也就是保护我们这个社会和我们的国家。好 ，Thank you everyone for your time tonight, and then everyone have a good evening, have a good night, and then hope you have keep safe, stay healthy. Thank you very much. Good night.